Hi, my name's Katie Bright, and I'm on the Family Nurse Practitioner track. So this presentation will look at the PICO question that I researched throughout this class, which was in youth athletes suffering from a concussion, how does physical and cognitive rest compared to active rehab affect symptoms during the first week post-concussion? So what is a concussion? According to the CDC, it's a type of traumatic brain injury caused by a bump, blow, or jolt to the head and causes the head and brain to move rapidly back and forth. This can lead to chemical changes and stretching and damaging brain cells. So the significance of concussions, they have a wide range of symptoms that can be short-term or long-term, including changes in thinking, sensation, language, and emotion. Up to 3.8 million concussive injuries in just youth related to sports occur each year, and that's just in the United States alone. And repeated concussions can lead to several deficits and even sometimes can be fatal. So concussions are one of the most difficult athletic injuries to diagnose since you can't see them and there's just so many different clinical presentations. There's no gold standard that exists for diagnosing or treating, and research is lacking among the PEDS population when it comes to concussions. So currently, just physical and cognitive rest is recommended just to reduce the potential of a repeat injury. The CDC created a program called Heads Up, which provides information and allows people to learn how to recognize and respond to a concussion, and it provides recommendations on when it's okay to return to activity. It offers information about concussions to coaches, parents, and athletes involved in youth sports, and all of their resources are free. The goal of the program is just to protect kids and teens by raising awareness to improve prevention, recognition, and response to concussions. So the first article I used looked at a systematic review that examined how physical and cognitive rest compared to active rehab affected the severity of symptoms and length of recovery time. So a few assessments were used throughout the study to gauge recovery. The first was a total symptom severity score, which looked at things such as symptom duration, neurocognitive function, and balance assessment. The next one was activity intensity and cognitive activity scale, which both just ranged from 0 to 4 and measured how much activity the participants had throughout the study. The Buffalo Concussion Treadmill Test measures activity and tolerance and was used to examine how long it took patients to return to activity without experiencing any symptoms. And then the Zurich Return to Play Guidelines is actually currently used by a lot of major sports organizations, and it includes 6 stages that the athletes are progressed through if they don't experience symptoms, ranging from like normal daily activity to full-on game competition. So after looking at all this literature, they came to the conclusion that after prescribed rest, there was a significant improvement in cognition as well as a reduction in symptoms. And that rest period was usually 24 to 48 hours and resulted in better outcomes and decreased symptoms quicker than if activity was incorporated like right away. They also found that too much strict rest for too long could potentially delay recovery. And they found that rest is underused in healthcare providers among youth athletes when dealing with concussions. The next study was a randomized control trial that looked at the benefits of strict rest. So this study split the participants into 2 groups, either a strict rest group that was strict rest for 10 days or just the recommended 24 to 48 hours. They used something called the immediate post-concussion assessment and cognitive testing, or IMPACT, which measured neurophysiological test modules in 5 fields, and then the symptom post-concussive symptom scale, and it measured 4 domains of symptoms. So at the end of the trial, greater than 60% of patients in both groups experienced symptom resolution, but it did take the strict rest group 3 days longer on average. The strict rest group also had higher post-concussive symptoms, and they scored worse on the IMPACT testing. So in conclusion, strict rest did not improve symptoms, neurocognitive status, or balance outcomes, and incorporating active rehab after a short rest period did show to improve outcomes more effectively. The last article I used was a qualitative study that looked at lived experiences of adolescent athletes following a sports-related concussion. So the major study findings were that concussions caused major effects on their daily routines due to symptoms. It impacted their emotions, affected their ability at school and their social role, and led to minimizing and masking symptoms so they could stay involved and wouldn't be made fun of or miss out on anything. They also said that symptoms inhibited them from engaging in normal daily roles, which led to increased emotional issues. And then getting down to improving nursing practice, since there's no gold standard of care like mentioned earlier, Following the most current recommendations discussed in this presentation is widely used among healthcare providers. This includes the initial rest period, which has proved to be helpful and decrease symptoms in a shorter period of time. So following, like I mentioned, the recommended 24 to 48 rest period, because too much rest has proven to be detrimental to recovery and has prolonged symptoms. And then also just providing a detailed care plan with strict guidelines and expected timeline might help in the peds population, just to give them a general idea of what to expect when they're recovering. So nursing intervention, incorporating baseline concussion assessments into annual checkups could be super helpful. It just gives the healthcare provider information to gauge the patient off of if a concussion does occur. And doing things like testing cognitive status, memory and attention, or doing a balance assessment, or things like reaction time, that can just give the healthcare provider some baseline tests. You should always require a reassessment and clearance from a healthcare provider before the kid can return to sports, and just have information available for parents and coaches on things like signs and symptoms to be familiar with and do's and don'ts when it comes to concussion. So a healthcare environment that this information might be helpful in is among primary care providers or school nurses, since they're the ones that are usually doing the physicals that kids are required to get before they play in organized sports. So like I said, they will have a baseline to go off of, and it just allows them to have the most up-to-date data and recommendations for treating kids with the concussions. So hopefully this information could be useful in your future nursing practice.